It's Wendy Bowen, physiotherapist with Know Your Body Better. So one of the most common complaints I have with clients is the pain that's in between the blades here. And what I see, and then this how it transfers into the lower back pain. So I'll give you an example. I had a client come in the other day, has ongoing lower back pain. It's been worse for about 1 to 2 years, had x-rays done, show mild arthritis. Well, most of us over a certain age have some mild arthritic changes. So that's probably not necessarily the cause of his pain. So what we do on testing, we check through the hips, check through the thoracic spine, and he's got a lot of tightness, myofascial tightness, which is compressing the lower back. It's more on one side than the other, which is going to tilt the spine this way and compress these joints. So his lower back pain is probably due to muscle tightness and fascial tightness and through the hips. Now, this guy's a very, very avid golfer. So what we want to do is if you stiff through here and stiff through the hips, because the buttocks are tight and the hips can't move, then all the rotation is going to happen in the lower back when he's doing his swing, and that will lead to breakdown in the lower back. So what I'm giving them are some exercises to loosen off the hips and loosen off the thoracic spine between the shoulder blades and hopefully take away the pain in the lower back. And just a little bit of work I did in those two areas did in fact take away some of the compression pain. One of the exercises I gave him, and I'm going to show you here today because he may need to watch this, is if you're lying on your back here, okay, hands together, elbows straight, fingertips touching, drop your knees to one side to get that stretch through the hips while you drop your arms the other way, keeping the fingers together and the elbow straight, because the tendency is to do this and bend the elbow or slide the hands apart. So we want arms, fingers together, elbow straight, dropping them off to one side while the hips go the other way to get that whole body stretch. So I'm stretching up through here and down through here, and then you can go the other way. Drop the hips one way, get the stretch through the glute, drop this the other way. And you can just do this back and forth, and that's going to give you the stretch through the hips and the thoracic spine where you need the stretch. So what I'll do in the next video is I'll show you a few more exercises where you can self-mobilize your thoracic spine and give you some stretches again for the hip muscles. So it's Wendy Bowen with Know Your Body Better.